Hey guys, welcome back to my channel. My name is Jess. If you are new here, welcome. Glad to have you. As you can see by the title of this video, I am a doula. I'm also a mother of 3, including newborn twin girls. And if you want to subscribe to this channel, it is all about sharing and following my life and my passion, which is birth and helping women through their birth, prepare for their birth, everything around it. So for this video, I know a lot of people have questions about doulas. What do they do? What they are? So I thought a really interesting and fun way to answer those types of questions would be to answer some of Google's most frequently asked questions regarding doulas. So that is what we're going to do today in this video. So let's look and see what people's biggest questions are regarding doulas on Google. The first question, and I have heard this question so many times, is a doula the same as a midwife? The answer to that is simply no. A doula, like myself, has no medical training. We do not do anything medical. We are not trained in it and we don't want to do it. A midwife has all of the same training as an OBGYN minus cesarean sections. So they can do the vaginal exams, they will check your blood pressure, they're going to do your temperature, they can break your water, they will deliver your baby. Doulas have no medical training whatsoever. We're trained in comfort measures, in reassuring you, emotional and physical support for your labor, and a lot of times during your pregnancy as well as postpartum. We are very knowledgeable about every aspect of birth, but we are not medically trained. The next question, is a doula worth it? Obviously, I'm going to be a little biased on this one, considering that not only am I a doula, but in my 2 births, I also had a doula for each one of those. And I will say, from my personal experience giving birth, not that this is my career, but from those perspectives, a doula is absolutely worth it. I am so grateful to both of the women who doulaed my births. Not only for myself, especially the first time you give birth. It's so nice to hear the reassurance that this crazy thing that you're going through that's happening to you is completely normal. That they have seen it 100 times and that everything is going to be okay. It's also really great to have someone help you navigate the hospital system and the hospital lingo when you have no idea what they're talking about. In addition to being great for you, a doula is fantastic for whoever is with you, whatever support person you have, be it your husband, your mother. I've even been in a birth with the only support person was the girl's father. And it is so nice to have another set of hands to check on them, to make sure that they're staying hydrated through your long labor, to make sure that they're okay, that they're understanding everything, that they see you in immense pain, and that they can have a voice to say, she's going to be okay. This is normal. You don't have to be afraid. Or why don't you try this to give her some comfort? It's really great having a professional guide you in a situation that especially men don't think about really finding themselves. They don't know what to do. It is fantastic having someone who is trained in it to know what to do, to say, hey, let's do some counter pressure on her hips. Let me show you so you can do it, and then step aside. So yes, to me, a doula is absolutely worth it. The next question is a doula a nurse? This is pretty similar to, is a doula a midwife? No, a doula is not a nurse. Now, a nurse could be a doula. A doula is really just emotional and physical support. She is an advocate for the woman, for the mother. There's a really great breakdown that I always refer people to when they ask what a doula is. If you think of the word doulas, think of the phrase deliverers of unconditional love and support. That is, in a nutshell, what we do. So yes, a nurse could be a doula for you. But no, we are not nurses. Again, we are not medically trained in any way. So a nurse will be conducting your vaginal exams. A nurse will be putting in your IV. We will not be doing that for you. The next question, is a doula necessary? Again, I might be biased on this question. Now, actually, I'm going to say no. A doula is not necessary. However, I do feel like some support person or support people is necessary for your birth. You need to have at least one other person who knows what your plan is going into delivery, who knows what you want, and who can advocate on your behalf when you are in immeasurable pain, when you are not thinking clearly because maybe you are on Demerol or something. You just can't communicate your wishes. If you have one other person who you have spoken to before, who understands what you want, and possibly more importantly, what you do not want, and who can advocate on your behalf, and who can be on your team, and who can support your decisions, and support you physically and emotionally, I do believe that is necessary. Now, that person does not need to be a doula per se. That person could be your husband, your boyfriend, your mother, a friend. I mean, it could really be anyone. But finding someone that you can communicate your wishes to in a thoughtful way to say, here's what I want, here's what I don't want, and I need you to be on my team, and I need you to be there with me, and that person take it seriously, that is necessary for your birth. The next question is, does a doula get paid? This really depends. How I have worked as a doula was in a hospital setting. And yes, we were on staff at that hospital, so we did get paid. And it was not a lot because we don't do it for the money. We do it because we love it. Now, private doulas, yes, most of the time. Private doulas do get paid. And their price range could be great. There are some doulas who are maybe, they've got 20 years of experience. They could be thousands of dollars. There are other doulas who maybe are just starting out and they could be a couple $100s. They do exist. I know there is such a thing as volunteer doulas. If there is a doula who is attempting to be certified, she has to have a certain number of births, certain number of birth hours, in order to do so. So a lot of times those doulas are looking to give their services to someone for free. That is just something you would have to check, see if you can find one in your area. Does a doula deliver the baby? Again, nuh-uh, no. We do not deliver the baby. We do not want to deliver the baby. That is for a medical professional to do. Whether it be in a birth center, whether it be in a hospital, whether it be at home, a doula should not deliver your baby because we're not medically trained to do so. We will help you push that baby out. We will give you motivating words and be right by your side and loving on you and supporting you whatever way you need. But no, we do not deliver the baby. Does a doula have to be certified? No. A doula does not have to be certified. Certification for a doula means you go through an organization. Typically, the two big ones are DONA and CAPA. Both of those organizations, in order to get certified, you have to go through a lot of paperwork. You have to pay a fee. You have to have a certain number of births on record and hours, and then the patient has to let you use that information to be submitted in order to become certified, and then you have to re-up your certification every year. Once you are certified, your name goes on one of those two organizational websites, like I said, and then people can find you a little easier. You can charge more a lot of times, but no, you do not have to be certified. I personally am not certified. I worked at a hospital for several years as a doula. I have no desire to become certified. It's just not for me. I love my job. I want to keep doing this for the rest of my life, but I have no desire to be certified. So no. The next one I think is one of the most important. Does a doula replace my husband? And the answer to that is a resounding no. We do not replace your husband, your boyfriend, your sister, your mother, your friend. We don't replace anyone. The best doulas are the ones who can blend into the walls when need be. It is our job to support the mother, yes, but it is also our job to encourage the father or the support person to help support you. The best outcome we can possibly have in a birth is supporting the whole team, the whole family, in bringing a new life into the world. We are not there to replace anyone, and we try very hard, good doulas, try very hard to help the other part of your birth team engage more and be a part of the process and come through for you in ways you never thought they could. So we do not replace anyone. Think of us as just an extra little person. A lot of times I like to think of us as kind of like a wedding planner for your birth. You know, we're there. Make us do the grunt work. I have been in births where the only thing that I did was get people water, get people coffee, and rub feet. That's what I did. And that's what she needed me for. And I'm okay with that. That's my job. Because at the end of the day, this family had a good birth experience bringing this child into the world. That's the most important thing. So please do not think a doula should replace your husband or anyone on your birth team. The last question I'd like to get to today is a doula really worth it? And again, I'm going to say a resounding yes. A doula is totally worth it. There have been numerous studies to show that overall, the length of labor can be cut by about 25% with a doula present. The overall cesarean rate can be cut by about 50% with a doula present. The use of Pitocin can be cut by almost 40% with a doula present. And the request for an epidural can be cut by almost 60% with a doula present. We relieve stress. We relieve anxiety by answering those burning questions that you have, that you don't understand. Anything you don't understand, we can help answer. We can help get you to a better place of understanding so that you can turn off your brain and get into that primal state that you have to get into for birth. We can physically help you with pain relief. We can help you understand the medications that they may be giving you or the procedures that they're going to do. We can help you understand the overall arc of birth and get you ready. We can even help you understand what goes on in a cesarean birth. We will encourage you. We will support you. But one thing we do not do is push you into any given choice. The biggest reason I became a doula is because I believe in the power of women. I believe that a woman should have the right to choose how she wants to birth. There is such a stigma around, oh, she chose to have a C-section. Oh, well, she chose to try to do everything naturally. And women judge each other for these little decisions. And it's absolutely terrible because at the end of the day, what we want is a healthy mom and a healthy baby. It's the prayer that I always say on my way to any birth. Every mom deserves the right to try to have her baby in any way she wants to, and a doula can help her accomplish that. Listen, the one thing I always tell my patients, the only certain thing about birth is that it's not going to go the way that you think it's going to go. And the amnesia is real. And you will forget aspects of your birth. You absolutely will. Things get fuzzy, after 20 hours or something like that. You really don't remember all the details years down the road. but you will remember how you were made to feel in that room. Were you respected at every instance? Do you feel like you were given a choice at every step of the way, for every procedure done, for every milestone in your labor? Do you feel like you were in charge? The people around you respected you, supported you, and encouraged you. That you will remember. That you will never forget. So yes, I absolutely, wholeheartedly believe a doula is worth it. However you can possibly get one, get one. And keep in mind, with the right education, the right understanding, any person on your family, any one of your friends, can essentially be your doula. Someone to help you physically, emotionally, through the pain, who's on your side and who understands exactly what you want and can advocate for you without judgment. It's absolutely worth it. Please give this video a thumbs up if you like it, subscribe down below, and I hope to see you around soon. Thanks so much, guys. Bye!